to go, and we're gonna have a good show tonight, right? And I need to get fruitcakes for everyone.
Sarah!
Grandma?
What is this? What is all this stuff?
I'm getting ready for my show tonight, you know?
What show?
I have to play at
What is this?
Oh, I found this little dog. Hold on, Mom. I'm on the phone with my agent, Grandma. Hold on. I gotta call you back. I got too much going on.
No, but you can't just buy how much did you
It
spend?
was just a long. I didn't spend, I got this bag free with all the swimsuits I got at Victoria's Secret. I only spent $1,500. And it was
$1,500?
free with $75 purchase. What a deal, right?
That's not a deal. You
Grandma, you
spent
have to help me get ready. I have my show at 7.
What show?
We've got to go. Come on, Mommy. Come on.
With this poor dog.
Grandma, I've been telling you about my show for weeks. It's time. I've got to get ready.
I don't understand. This
Gotta
is not
go.
good. Sarah, this can't keep happening. This can't keep happening. Give me your wallet. We can't do this. We can't do
Grandma,
this
I've got to get ready. I don't have time.
We
don't have time.
can't do this
But
anymore.
let me show you all the great purchases I got.
Did you put?
It was such a good deal. They were all buy one, get one half off. And then I got this bag.
How many did you buy?
And I've got to get ready for my show tonight.
Did you put this on my credit card?
Yes, I did.
No, you're getting cut off. I'm calling right now. This can't happen anymore.
Grandma, you can't cut off my credit card. I have this show tonight.
No, you are not a rock star.
Yes, I am. I've been telling you
No.
for so long I have this show.
No, this isn't happening. This poor doll, we have to give it back. I can't. This is too much.
Come here,
I'm
Fifi.
calling now.
Come here, Fifi. She won't take you. She won't take you, Fifi. I refuse. I've got to go, Grandma. My agent. Where is my phone?
I'm cutting up your card. This is done. We're done. Where is it? I'm cutting it up.
She's going to take my card, and then
I'm going to cut this up, Sarah.
To get to my show tonight.
We can't do this anymore.
Grandma, no. If you take my card tonight, I'll kill myself. I can't not get to my show. I'll kill myself. Please, Grandma, take my
Oh my God. Thank God you're here. Come in.
Hello, ma'am. I'm a UCF law officer. Is there a problem?
Yes, my granddaughter, she threatened to kill herself. She just spent so much money and I took her card away and cut it up and she's over here.
Is she okay?
No, she's just crazy.
Yeah, I can't get it back together.
Here she is.
I can't get it back together.
Sarah?
Hello, Sarah. Is that your name? Sarah?
Yes.
Hi. I'm a law officer with the UCF Knights. Can you explain to me what's the problem here?
My grandma, can you see? You took my car and it's broken and now it won't work and now I can't get to my show tonight and I don't know how I'm going to get to my show and that's why did you do this, Grandma? I can't do it. I don't want to live like this.
Okay. I just need to know. Do you feel like you're a harm to yourself or anybody else right
I
now?
don't want to do this. I just want to die.
On the call, we said that she was possibly going to harm herself.
Yes, she threatened to kill herself if I cut up her card, but she spent so much money and bought this dog and put that thing on it. It's so beautiful.
She's wearing a matching bathing suit I bought.
Okay, ma'am. Can you just explain to me if you're going to hurt yourself or anybody else?
I already said yes.
Okay, ma'am. Because you said you're either a harm to yourself or somebody else, I'm now going to have to Baker Act you.
The only people who can Baker Act somebody are a judge, a doctor, and a law enforcement officer.
Okay, I'm now going to have to transport you to the nearest facility.
Okay, we have a 22-year-old Caucasian female with bipolar disorder. She was brought in for a Baker Act by law enforcement. She threatened to kill herself. She lives with her 76-year-old grandmother, and she's the one who called. She is currently single, and she lives with her grandmother, and she is unemployed.
Okay, and since our situation here is a patient with bipolar disorder, they are characterized by 2 moods, usually alternating between mania and depression. And usually when they're in a manic state, they're very irritable, elevated mood, and they also have persistent increase in activity and energy, very impulsive, which is probably why she was brought in here. And the mood alternates between mania, hypomania, and depression.
Okay, and it occurs equally in men and women, and the average onset is early 20s.
Yeah, which fits our patient roles because she's 22. And they're either brought into our facility either because they're in a manic state or a depressive state. And if they're in a manic state, they usually haven't slept or eaten in many days. And the reasons our patients was brought or admitted to our facility is because she spent a lot of money and has tried to commit suicide and harm to somebody else.
And if they are in a depressive state, a bipolar patient will be brought into our facility for lack of self-care. And it is due to their depressed mood and their attempt at suicide. And suicide ideation is a risk for both manic and the depressive state. And we can have them come in.
Right this way.
Thank you.
Okay, and now we will do an interview in which we will perform mental status assessment, and the demographic data and reason for admission were previously identified. Hi, Sarah. My name is Ellie, and this is Kiara.
Hi.
We are both nurses, and we're going to be asking you a couple questions today.
I don't want to answer any of your questions.
Can you tell me what brought you in here?
My grandma, she cut up all my credit cards, and I couldn't go to my show. And then if I couldn't go to my show, I just didn't want to live anymore. My show is my life, and I'm a rock star, and I couldn't do my show. And I don't know why.
She has this idea that she's a rock star and is famous, and she spent a lot of money, my money, out. And then when I told her that she couldn't do it anymore, she threatened to kill herself. So I called the cops because it's just got too out of hand. She spent $1,500 at Victoria's Secret.
Okay. Okay, your grandmother.
Yeah, you're the do you have any previous history of any other mental illness disorders? Any family history, maybe?
Well, her mother, my daughter, she had bipolar disorder as well, and she committed suicide when Sarah was very young. And, Sarah's always been a very anxious girl, had lots of anxiety, and she's had very bad behavior, gotten kicked out of school, kicked out of many jobs, fired. She just, and sometimes she steals my medications, and...
Okay.
Don't know what to do.
Only when I'm sad.
Bipolar disorder has many theories around what may cause it, one being genetics. So in this case, it does run in her family. Usually other comorbid conditions that occur with bipolar are anxiety, panic attacks, conduct disorders, substance abuse, and major depression.
Okay, so next in our assessment, we would address her dress and her grooming, eye contact, hygiene, posture, any tattoos or identifying features, her stated age and appearance, her overall appearance.
And bipolar individuals' dress reflects their grandiose personality. And you can see with Sarah, she has excessive makeup on, she has hair dye, and their dress may be described as outlandish, bizarre, colorful, and inappropriate. And makeup may garnished and overdone.
Okay, and next we would also evaluate her activity level, hyperactive, lethargic, pacing, restlessness, posturing, and slow. With bipolar, it would depend on whether they're in a manic or depressive state. Obviously, you can see she's pacing and very irritable, and we could note her inability to sit down, her restlessness, and her red eyes do indicate that she probably hasn't slept in days.
I know it's getting bad. She hasn't slept in several days. She hasn't eaten. She hasn't showered. And when she was first diagnosed, it wasn't this bad. So I kind of never gave her medications. But this is bad. It's gotten bad. She's constantly cleaning the house and shopping, whether it's 2 p.m. or 2 a.m. She just sends constant emails, makes constant calls, talks to this lady she thinks is her agent constantly. She's extremely excitable and has maxed out all my credit cards. And she just buys really expensive, outlandish gifts for all her friends. And I don't know any of those people.
Okay. If this patient arrived in a depressive state, we would note the same things as a patient with depression, being lethargic and slow. And then next we would assess the patient's facial expression.
My fans, they're just so excited about the show, and I know that they were going to love it, and it was going to be such a great show, and I was so excited to do my show. It's the only thing that makes me happy. I just love doing my shows.
and which again would be based on what mood the person is in. Sarah is in an elated mood, so it's appropriate for her mania. And if the patient was in depression, we would note that the patient may be uninterested with a flat affect.
Okay, so noting the person's behavior, we would see that they're unable to sit still and they start many projects but rarely finish them. They become involved in activities that are pleasurable but have many consequences, such as spending a large amount of money on frivolous items and giving money away and making foolish business decisions. And they may laugh and joke in a continuous stream, but they don't know strangers or boundaries, so everyone is their friend to them.
Hey, guys. What did one saggy boob say to the other? If we don't get some support, people are going to think we're nuts.
Okay, that's a little inappropriate, okay?
Yeah. Their energy and confidence is boundless, and they throw lavish parties and visit expensive nightclubs and restaurants frequently.
With a body like that, you'd be a great addition to my show.
See, this is constant. She does say stuff like this, and then she spends so much money in stores. She bought a dog. We don't need a dog.
She was cute.
Well, that's not a reason to buy a dog.
Bipolar patients may be manipulative, profane, fault-finding, and exploit others' vulnerabilities, and their speech is rapid, verbose, and circumstantial, and they may not take a breath. They may talk too much, and they may also experience paranoia.
Their thought content is next. Approximately 50% of patients with bipolar disorder have psychotic symptoms. Patients in mania may experience delusions. They may believe they have superpowers or are God. They may have hallucinations. They may experience paranoia. Their content of their speech is often sexually explicit and ranges from inappropriate to very vulgar.
Speech is loud, bellowing, or even screaming, and grandiosity is apparent. The theme of the conversation may be extraordinary sexual prowess or artistic talents.
Oh, guys, look what I've been working on. We've been sitting here. I did this lovely painting. It's for you. You don't like it? Fine.
Okay, thought processes is the next section in the mental status assessment. Individuals with bipolar will experience flight of ideas, which is nearly continuous flow of accelerated speech with abrupt changes in topic that are usually based on accusations and planned words. They may also experience king associations, which are stringing together words because of their rhyming sounds without regard to their meaning.
How are you doing, kid? Kidding around? I'm going home. Home sweet home. Home is where the heart is. Just get me out of here. Hey, Doc. What's up, Doc? Have a carrot?
The mood of an individual with bipolar disorder will vary like with anything else. In mania, the patient may be euphoric and state a intense feeling of well-being. They are cheerful in a beautiful world or becoming one with God. This mood may change to irritation and quick anger when the person is angered. The irritability and anger may be short-lived or may become the prominent feature of their mania.
When the person is elated, the overjoyed mood may seem out of proportion with what is occurring in the person's environment. Elaborate plans to become rich and famous may be pursued despite objections. These individuals may experience perceptions such as delusions and hallucinations. Their affect would depend on their mood, and if the individual is depressed, it may be flat or blunted.
So Sarah's judgment is impaired and she does not realize that she has a problem.
I don't have a problem. I don't know what you're talking about. Everything's fine. Me and Grandma do great. And now we have a dog that's so lovely. And I don't need a job. Grandma takes care of me. So, and I'm, doing my shows and everything is fine.
At this point, it's very important to ask the patient if they have any suicidal thoughts or homicidal thoughts. Sarah, are you having any suicidal thoughts today?
I mean, I did earlier today, but if my grandma gave back my cards so that I could go to my show, everything would be fine. But if she's not going to give me back my cards, then, yeah, I feel like I don't want to live this way.
Do you have a plan?
Yeah, I took the scissors, but, however, I can do it at the time. If she's going to take my cards, I don't know. And it'll be all right.
Everyone, we're here for group therapy. Today we're going over medication management and mood stabilizers. My name is May. I'm one of the nurses.
My name is Melinda. I'm also a nurse.
My name is Kiara.
My name's Matt.
What is it,
My name's Matt. I'm a patient.
Listen, Eminem from 8 Mile. That's enough.
Guys, let's just go on
My name is
order
Matt.
and introduce ourselves, please. What does it matter? We're doing medication management group. I wanted to know your name. It's
My
Fabiola.
name is Matt.
Well, now it's my turn. I'm Danielle.
I'm Sarah. I don't have bipolar. I don't know what that is. What are we learning here? I really want to go eat.
We're going to talk about medications and then we'll go for a snack and break, okay?
Our first medication that we're going to talk about is lithium. Lithium is a mood stabilizer medication, and what it does is it is one of the main medications to treat bipolar. This medication, there's other mood stabilizers, but what they do is they help to balance the chemicals in the brain. So if you might be feeling sad and depressed, then it will help bring up your mood, or if you're feeling manic and overreactive, it will help bring down your mood. Bipolar disorder is always a lifelong treatment. So once your doctor prescribes you medication, you will be required to take this medication unless your doctor changes it or makes some other type of recommendation for you. But it is important to always have your medication, to take it as scheduled by the doctor. Lithium is one of the most common medications for treating bipolar, and sometimes it can take up to 3 to 5 weeks for it to really take effect into your body. It's really important that the doctor monitors your lithium levels in your blood. So the doctor is going to order some blood work to be done before you actually start taking the medication. He's going to be looking at your kidney function, your liver function, and make sure to get the baseline levels of your body.
What does that mean? Liver function? My liver's just fine. I have 3 drinks a day.
Oh, wow. Well,
Listen. My doctor told me this will kill my kidneys.
It's gonna kill my kidneys? I can't have my kidneys.
You're gonna go into
being
renal
killed.
failure and die,
Lithium
baby.
can-
That's what's gonna happen. You're gonna go into renal failure and we're all gonna die.
no, you're not all going to die. Let me finish giving you the information, then maybe you'll feel more comfortable about
I'm
what
dead.
I feel great right
I'm
now.
dead.
I'm already comfortable.
All right.
I'm dead.
We have to maintain a nice environment for everybody to learn appropriately, okay? So let's try to keep our comments to ourselves for the time being. What the doctor is looking for is to maintain your blood levels between 0.6 to 1.2. And that's to make sure that the medication is going to be working in your body efficiently, okay? The doctor wants to make sure that that you are taking your medications as prescribed. And it is very important that when the doctor orders you to have blood work done, that you don't miss any doses of your
Talking to
medication
me.
and that you do not take extra doses of your medication. So he's going to order your blood
doesn't know
work.
anything. Okay,
Doctors
I'm gonna
are
take care of
very-
myself.
Doctors are
I
very
don't
Talking
know
to
the
me.
doctors. I don't even know why.
So what
He
do you
is
think?
stressing me out. Like, can we get him some happy pills or something? I want him to be as happy as I am right now. Lighten up, dude. Everything is fine.
It is very important.
I want to be wishy on.
It is important. I'm
You're laughing at me.
Important tips.
Matt, no one's laughing at you.
While taking lithium, there are some really important things that you want to make sure that you're doing as a patient. One thing is that lithium is very sensitive to when your body becomes dehydrated. It gets very thick in your body, so you want to be careful and make sure that you're always drinking plenty of fluids. You want to drink like about 8 to 12 glasses of water a day or juice. But you really want to be careful to stay away from too many caffeinated beverages like sodas and coffee.
What kind of sodas have caffeine in them? That's all I drink. I don't drink water, juice. Okay, I just drink soda. That's all I drink. I like Pepsi, and that's all I drink.
You really want to try to limit your Pepsi intake, maybe to 1 or 2 cups a day.
So
But
can
it's
I have root
important.
beer instead?
Soda has a lot of salt in it, which is something that you also need to monitor with lithium.
Yes, you really want to be careful not to have too much soda. So maybe 1 to 2 cups a day, but you really want to try to drink a lot of water.
I
It's
don't
very
like water.
important. They do
Beer has
have-
water in it.
They do have some
Can I have
flavored
beer?
waters. No, beer's not really good for you. But they do have some flavored waters or special waters that you can drink or juices to help keep your fluid intake up. Because lithium in your body does act like a salt, like May said, that salt is important to monitor. You want to be careful to have a normal and constant salt intake in your diet. So you don't want to have a bunch of salt one day and not any salt the next day. You want to try to keep your diet a normal constant.
So I should add a bunch of salt to my food.
No, you don't want to add a lot of salt. If you use a little bit of salt, that's fine. Just keep it constant throughout your days.
Just eat soup.
You want to be careful with soup because a lot of canned soups especially are very high in sodium, which is salt.
Oh, okay.
Yeah, so you do want to be careful with that. Another important thing is if you like to exercise and work out, who likes to exercise?
I work out 8 hours a day.
Exercise is great. It's really important to do that. If you're sweating a lot, you want to make sure you keep those fluids going in so your body doesn't become dehydrated. There are some important things to watch out for when taking medications, like side effects.
So is it gonna do something to me? I'm gonna have side effects? What's gonna happen?
You could have some side effects, and there are some side effects that are considered normal, and that it's okay that you may experience these things. It's not harming your body. You may experience a headache, you might feel a little nauseous. You may feel like a metallic taste in your mouth, like a metal, or you might have a little tremor in your hand. Those are some normal side effects.
Should I stop taking it if that happens?
No, you never want to stop taking your medication. You would, if you have
I'm not
any
taking my
concerns-
medication.
If you have any concerns, you would want to talk to your doctor though. His doctor is really going to want to monitor how your body is reacting to your medicine. Now, the reason why I mentioned that it's important for the doctor to monitor your lithium levels within your body is because if it gets too much in your body, it can become toxic. So this is why it's important to keep your appointments with your doctor that they set for follow-up. It's important to do your blood draws that they request. And if your lithium levels go above 2.0, that is a toxic state of lithium. You might experience nausea and vomiting, severe diarrhea, and poor coordination. These are something to be watchful for. If you notice these signs, you definitely want to call your doctor right away.
Well, how long am I going to be on this lithium? Because I feel like I've been on it forever.
You're going to be on your mood stabilizer medications like lithium for the remainder of your life. Some of the problems that could arise if your body remains in a toxic state for a long period of time is kidney failure, nystagmus, which is where your eyes, shaking of your eyes, seizures, coma, and even death. So it's very important to follow the instructions by the doctor.
So when do we get this monitored? How do we know? I don't want to be toxic.
The doctor will let you know when it's time for your blood draws, but at the beginning, he's going to be checking your blood about every 4 to 5 days until they find the right dosing range for you, because everybody is individual. And after that, they'll monitor it every month to 2 months to make sure everything is maintained in a proper manner.
Do you guys have any more questions about lithium before we move on?
Well, if I start feeling funny, I'm going to call you.
You call the doctor. The doctor is in charge of your prescription.
I call him.
Yes, you call the doctor.
So it's gonna make me better?
What's that?
So it's gonna make me better?
The lithium is going to help to stabilize your mood. So you'll have a more constant, normal mood instead of ups and downs, ups and downs.
This rolling some down in her life.
I feel great.
Well,
We can go shopping later if you want.
They all
Let's discuss other medications besides lithium. There are other mood stabilizers out there that are good for bipolar disorder. Those also include anticonvulsants, which can be used for seizures. Medications include carbamazepine, valproic acid, lamotrigine, oxycarbenzapine, and topramate and gabapentin.
I have seizures.
Well, we're going to discuss different bipolar medications, so you might want to listen to this. Carbamazepine is the first medication. It's also known as Tegretol. It's an anticonvulsant, and it's effective for people that don't respond well to lithium. So if it doesn't work that you're on lithium and people have other side effects, then you can be put on carbamazepine. It's been effective to show rapid cycling bipolar disorder and acute mania, and it is approved for bipolar episodes, but it's also used in maintenance of treatment. Does anyone have any questions about carbamazepine?
Yeah, how's that gonna make me feel?
Well, some side effects to carbamazepine are drowsiness, dizziness, ataxia, which is when you have muscle spasms, nausea, vomiting, heart block, and aplastic anemia. So it's important to continuously be monitored for this medication. And if you take an MAOI, which is a type of antidepressant, you should not take this drug within 14 days.
Also, I can't have that one because I have that too.
Okay. There's other medications that we can discuss. Valproic acid is one of them. It's been shown to be effective in treating rapid cycling bipolar disorder as well as aggressive or behavioral disorders, and it's used in combination with lots of other medications. It's approved for mania in bipolar disorder, and some of the adverse effects are nausea, vomiting, diarrhea, abdominal cramps, and pancreatitis, as well as hepatotoxicity.
My doctor says that I need to have my liver checked because I used to drink a lot.
Yeah, so liver function testing is an important test, and we just want to make sure that your liver is doing okay. If you drink before, it might put you at risk for hepatotoxicity, which means liver toxicity.
My liver is just fine.
It might feel
I'll
fine,
eat your
but
liver.
over time it might have some pretty bad side effects, and the liver function can decrease. So that's why it's important to follow up with your doctor regularly, okay?
Whatever.
Lamotrigine, also known as Lamictal, is also approved in maintenance and treatment for bipolar disorder, but it's the most effective anticonvulsant mood stabilizer in bipolar depression. It's usually really good for maintenance therapy. And something that we have to watch for if you're taking this is Stevens-Johnson syndrome, which is a rush. Oxcarbazepine, also known as Triliptal, is a medication that's used as an off-label bipolar mood stabilizer. And the drug interactions are much less significant with this medication.
So wait, do I have to have, the doctor put me on this one? Do I have to have my levels checked? Is this something I have to get like a blood test for every week? Because I really don't have time to do that.
No, this medication most likely doesn't need to have your levels checked because the plasma levels and hematologic levels are usually not necessary. Drugs that are used as off-label mood stabilizers are topiramate, which is used as a bipolar disorder mood stabilizer, and gabapentin, which is also known as Neurontin and sometimes used off-label. It can be used with other medications for seizures, and adverse effects of that are drowsiness, fatigue, weight gain, and GI upset. So you might have stomach aches. All anticonvulsants come with an FDA warning for drowsiness, vision problems, blood problems, skin rashes, and liver problems. So you want to be monitored regularly by your doctor. And you want to take your medications the right way every single time. Does anyone have any questions before we finish today's discussion?
I do have a handout that I would like to give to you. Here, if you could please take one and pass it around. And this is some important things because I know we gave you a lot of information. And this basically is something that you can take with you and read to remind you about the importance of lithium because it's a very sensitive medication as far as maintaining your salt intake, making sure you're drinking enough water, juice, even milk throughout the day, and avoiding caffeine beverages like coffee and soda, and always to prepare for your drug tests, or your blood tests, as the doctor orders that for you. And you want to be careful to maintain your levels by taking your medications the right dose at the right time, just as the doctor prescribed you. And I also added here special information as far as the things that you need to notify your doctor if you experience, such as severe diarrhea, vomiting and nausea, poor coordination. You may, if you hear ringing in your ears or blurred vision, that's something you want to tell the doctor too. Okay?
We are here discussing Sarah. She's been with us for the past 72 hours, which is what her Baker Act was, and that time is up. So now we're discussing what our next step is in the treatment process. Currently, these past 3 days, we've been focused more on safety, more on her health status, medication, just ensuring that she stays safe and that all of her vital signs, everything is good. So, and she's done very well. She's responded well to the interventions that we have put in place. Some of those interventions are, we've done some group therapy. We discussed coping skills, ways to cope with the impulsivity that she has, ways to other outlets perhaps that instead of going and shopping, other things that she could do. We first approached, we created a non-stimulating, a calm environment, because stimulation is not good for someone in an acute manic state. We wanted to try and keep as calm as possible and have them come down. We were able to discuss with our staff, and we set limits. We were, very firm. You have to be like that with someone with acute mania. We also wanted to make sure she was eating correctly and eating enough, because people in an acute manic state can tend to not eat enough and then lose weight. And so we gave her several small high-calorie foods several times a day to make sure that she was eating enough and maintaining calories. We also, sleeping was a big issue. The first night we had to medicate her so she could actually sleep, because you don't want to sleep if you're in an acute manic state. You don't want to do that. We also started her on lithium. It will take a while for the effects to, for it to become consistent, for her feeling.
For her to not be so groggy?
Yes.
Okay.
And so during this time of adjusting to the medication, we need to make sure that she's compliant taking her medication, because the euphoria you feel in an acute manic state feels good. And whereas this, feeling groggy, feeling drowsy, feeling down does not feel good. So we have to make sure she's taking medication, and it will get better as her body adjusts to the medication. She also has a pamphlet, the things we discussed in medication group, things to watch out for overdose, toxicity, those kind of things. She has been educated in. She has those materials, and we'll pass those on to you as well.
Thank you.
Do you have any questions?
No, I don't. Thank you.
As of this time, it's my recommendation that we discharge her with an appointment to see an outside counselor and a psychiatrist to maintain her levels and to continue her therapy.
Okay, thank you, Dr.